So, good morning everyone. Am I audible and visible to everyone? Am I audible and visible to everyone? Please tell me. Good morning, Safi Ahmed. Good morning. Okay, so I'm Dr. Naveen Porwal. I have done my MBBS and MD from KGMC Lucknow. And this is first of all about Plus subscription. If you subscribe Plus for Unacademy, you will get daily live classes, structured courses, live tests and quizzes, and you have unlimited access. For example, if you subscribe for Unacademy, you will get avail to every batch course. It is not that you can only hear the class of physiology or medicine. If you take the subscription, all courses are open to you, and there are so many courses and there are so many types of subscription. This is a unique iconic subscription. If you are taking the iconic subscription, you can get the best of the Unacademy as well as best of the prep reader. In prep reader, there are recorded video lectures, there is question bank, there is rapid revision courses. In Unacademy, you will get live classes daily. And this is about the daily free test series on Unacademy. NEET PG T20, FMG Daily T20, NEET PG 2022 and INCAT 2021. And timings are 8 pm, 8:30, 9 pm and 9:30. And for 20 questions, you have 20 minutes for this. And these are the various batches for syllabus completion. And for this, you have to download the Unacademy app from your Play Store or iOS platform. In both, it is available. And they are the various packages available. And if you enter the code is Dr. Naveen -YT. If you add this code, you will get all this offer, 54% off, whatever maximum discount you want, you can get by this code. Okay, for any subscription. After that, let me tell you about some important batch courses which are going on. So these are some upcoming batch for NEET PG. Intensive revision batch for NEET PG 21, 18 January. Target batch for FMG, 18 January. Target next 22, morning batch and evening batch. There are two types of batches. So whatever fits to your schedule, you can join according to that. And the code is Dr. Naveen-YT. So after that, let me start my discussion. Okay, so we have discussed a lot about a lot of questions. So starting with question number 1. If they are asking a long question about enumerate the mineralocorticoid secreted by the adrenal gland, describe the mechanism of action of aldosterone and add a note on aldosterone escape. This is a 10 marks question. This is a 10 mark question. So how you will approach to this question? So question is about adrenal cortex. Let me make this again. So everyone knows there are 3 zones in the adrenal cortex. Although they have asked about mineralocorticoid, but you have to do a brief introduction that there are 3 zones: zona glomerulosa, zona fasciculata, zona reticularis. Okay, and I will not provide the full form because time is less, but in examination never use short form. You have to write everywhere the full form, and this releases mainly aldosterone. Question is about aldosterone. Fasciculata is mainly for release of cortisol, and reticularis is mainly for what? Sex corticoid, like precursor is dihydroepiandrosterone, which can be formed into testosterone and also into estrogen. So question is asking about, you can see once again, question is asking about mineralocorticoid, especially aldosterone, the function and the mechanism of action. So what you are going to write in the mineralocorticoid? What is the function of aldosterone? The function of mineralocorticoid, the most important mineralocorticoid, you must write that this as collecting duct. And this is your principal cell. This is your collecting duct. And this is your P cell, or called as principal cell. This is the nucleus of the principal cell. Now you know that aldosterone is a mineralocorticoid. It is a protein or it is a steroid. What do you think? It is steroid. Inside, it should enter inside the nucleus, yes or no? So for that you should know the brief description of the channels and the pumps which are present over here. This is called as sodium potassium pump. Then there is a ENaC channel. This is called as ENaC. What is the full form of ENaC, by the way? Anyone? What is ENaC present in the luminal side of the collecting duct? Yes, what is full form of ENaC? Epithelial sodium channel. It's epithelial. Let me write it. You can comment in this live. Yes, sodium epithelium. Yes, very good. It's epithelium sodium channel. So it is always present. So what is use of aldosterone? When ENaC is already present, so what is use of aldosterone? Sodium can come, and so you know that it is already present, so sodium can come like that and can be reabsorbed. So what is the need of this aldosterone then? Actually, problem is that this ENaC epithelial sodium channel is needed by a protein called as NED protein. So although it is present, but it keeps on degrading by NED protein. So what is role of aldosterone? What is role of aldosterone? The काम क्या है? Aldosterone prevent the degradation of ENaC by NED protein. So this aldosterone will go inside the nucleus, form various genetic regulation, and it prevent degradation of NED. So that sodium can be absorbed and potassium can be secreted. So main function is to reabsorb the sodium and to secrete the potassium. But this much is sufficient for 10 marks question. So you have to write the clinical of this. So do you remember any clinical of this? There are two diseases which are linked with the aldosterone. What is that? One is called as Cone syndrome. One is called as Cone syndrome, and other is called as Liddle syndrome. If you want maximum mark mineralocorticoid, but you have to write the clinical relevance of this. So what is Cone syndrome and what is Liddle syndrome? Cone syndrome is called as primary hyperaldosteronism. Primary hyperaldosteronism. In this, there is increased secretion of aldosterone. So what is going to happen if there is increased secretion of aldosterone? And that can cause hypertension. And what is Liddle syndrome? Liddle syndrome. And what is Liddle syndrome? Liddle syndrome is gain of mutation of ENaC. It is gain of mutation of protein ENaC, epithelial sodium. So it will also reabsorb sodium and it can also present with hypertension. It can also present with hypertension. But aldosterone level in Liddle syndrome is more or less. What do you think? Aldosterone level in Liddle syndrome will be more or less. What about aldosterone level? Because there is more sodium reabsorption, it will decrease the secretion of aldosterone. So aldosterone, this is the important point, aldosterone secretion will decrease in comparison to the Cone syndrome when aldosterone is more. That is why it is called as pseudo That is why it is called as pseudo hyperaldosteronism. Why pseudo? Because actually there is hypo, not hyper, but it look like as if patient is having Cone syndrome, as if patient is having Cone syndrome. So in the long question of aldosterone, you have to mention these two diseases. One is Cone syndrome, other is Liddle syndrome. In this there is more aldosterone. So what will be the management? What will be the management of the Cone syndrome? If there is more secretion of aldosterone, what can be the management of Cone syndrome? You want to suppress it by giving aldosterone antagonist. So you can use spironolactone. You can do spironolactone. But in the Liddle syndrome, problem is not the aldosterone. Aldosterone is less. It is not more. So what you will give here? You will give ENaC blocker. So which drug is ENaC blocker? You can give amiloride. You can give amiloride. So first of all, you have to tell what are the three zones, what is the function of aldosterone, and then what is the clinical feature of aldosterone. One is Cone syndrome, which is called as primary hyperaldosteronism. Other is Liddle syndrome, that is pseudo hyperaldosteronism. And this is the clinical feature as well as the management. Then in the same question you will see they have asked about the add a note on the aldosterone escape. So you cannot escape with this aldosterone escape. You have to write this also. So what is aldosterone escape? Just write the heading over here. What is aldosterone escape? What is aldosterone escape? Anyone? This is a question important for PG also, MBBS also. Suppose that there is Cone syndrome. Suppose that there is Cone syndrome in which there is increased amount of aldosterone. So what do you think? There will be increased sodium and water. So there will be edema or not? Do you think there will be edema? This is the collecting duct. You know that there will be a lot of absorption of sodium. Along with the sodium there is absorption of water. So what do you think? If there is increased aldosterone, there should be edema or not? Because there is increased sodium and water reabsorption. There is increased sodium and water reabsorption. So what do you think? There should be edema or not? Reflex. Which reflex? Which reflex is it? It is called as Bain-Bridge reflex. So whenever in your body there is edema, it is sensed by right atrium volume sensing receptor, and they initiate Bain-Bridge reflex, and they will cause increase in the heart rate, number one. Number two, increase of the atrial natriuretic polypeptide, number two. And number three, decrease ADH. So when there is decreased ADH, function of ADH is to reabsorb water. But if there is decreased ADH, absorption of water will be less and release of water will be more. So because of this Bain-Bridge reflex, there will be no edema. There will be no edema, and this is called as aldosterone escape. So this is the full question. This is the full question. If you want full marks, you have to attempt. Okay, where it is? Just a minute. Okay, so this is the full question, and it comprises of three parts. Number one, enumerate mineralocorticoids secreted by anal cortex, describe the function and the mechanism, and add a note on the aldosterone escape. So only if you write all the three parts, you will get full. Second question is about the enumerate the function of basal ganglion and write briefly the disorder of basal ganglion. This is the full question. So what you will write in this question? So this topic is very important for PG as well. A lot of questions come from basal ganglion. So first of all, you have to write about the component of basal ganglion. What are the component of basal ganglion? Then we can come to the disorder. What are the component of basal ganglion? Yes, anyone? Number one, it is corpus striatum. Corpus striatum. Corpus striatum is formed by combination of what? Anyone? Remember CP, cannot place. C is for caudate nucleus. C is for caudate nucleus and P is for putamen. P is for putamen. So the first component of basal ganglion is corpus striatum. Second component is lentiform nucleus, lens-shaped nucleus. I used to remember like that when you are preparing for your PG examination, power of lens increases. So remember PG, postgraduate examination. P stand for putamen and G stand for globus pallidus. Putamen and globus pallidus. Globus pallidus can be externus also and internus also. Then the third is, what is the third one? Thalamus is not part of basal ganglion. It is subthalamic nucleus. It is subthalamic nucleus. And the fourth part is a black substance in the midbrain, substantia nigra. Substantia nigra, which releases dopamine and causes fine tuning of muscle movement. So first of all, you have to write about the component of basal ganglion. You have to write about the component of basal ganglion. Now, what are the diseases? What are the diseases? We discussed a lot of time this topic. Let me cut it short and tell me fast. Diseases, number one, the most important disorder of basal ganglion is Parkinsonism. What is Parkinson disease? Or Parkinson disease. What is Parkinson disease? Yes, anyone? The mnemonic is TRAP. The clinical feature of Parkinsonism is TRAP. T stands for tremor. These tremors are not intentional. Intentional you will get in the cerebral disorder. These are resting tremor. R stands for rigidity. R stands for rigidity, and there are two types of rigidity in the Parkinsonism. One is called as lead pipe rigidity, other is cog wheel rigidity. A stand for akinesia, means inability to start the movement. Akinesia or bradykinesia. So inability to start the movement. P stand for pin rolling movement. Then there can be mask face. There can be mask face, or it is also called as serpentine look. Serpentine look, as if a snake is looking, because there is loss of facial expression, so you will feel as if some snake is looking at you. And this Parkinsonism is due to lesion of dopaminergic nigrostriatal pathway. Nigrostriatal pathway, and it's very obvious that management will be, of course, you have to give levodopa and carbidopa. Levodopa and carbidopa, because there is lesion because of dopamine. Number second, there can be disorder called as chorea. What is chorea? What is chorea? The disorder of basal ganglion. It is involuntarily purposeless jerky movement. These are jerky dancing movement. These are the jerky dancing These are jerky dancing movement. And what are the disease in which you can get chorea? What are the disease in which you can get chorea? They are very simple. There are so many, but at least you should know few of them. Number one, Huntington chorea. Huntington, it is an autosomal dominant disorder, chorea. Then this you can get in the Wilson disease, when copper get deposited in the lens and all those things. Hepatolenticular degeneration of copper, Wilson disease. Then there can be rheumatic fever, in which you can get Sydenham chorea. You can get Sydenham chorea. So, and also in the pregnancy, which is called as chorea gravidorum. In pregnancy also sometimes you can get chorea gravidorum. So the second disorder is chorea. First was Parkinsonism. Third is athetosis. What is athetosis? What is athetosis? It is also involuntary purposeless movement, but it is slow wrestling movement. It's slow. It is not jerky movement. Involuntary purposeless slow wrestling movement, like snake, like as if snake dance is happening. Okay, slow wrestling movement. And the fourth one, balismus or hemibalismus. This is due to lesion of which part of the basal ganglion? You will get balismus or hemibalismus. It is called as flailing movement of the extremity. It is called as flailing movement of the extremity. And this is due to lesion of subthalamic nucleus. So there are so many types of disorder of the basal ganglion which you have to enumerate one by one, along with the pathway which we have discussed in the previous classes also. I am just telling you how to approach to the paper of MBBS first year. So you can see, you have to write the function of basal ganglion, the pathways also, and briefly disorder of the basal ganglion. Only then you will get full marks. Okay. Then phases of cardiac cycle we have already discussed. Then the various temperature regulation. This is the full marks question of temperature regulation. So if this question comes in the full marks, what you will write? If there is a question in your professional examination regarding temperature regulation, what is the basic theme of the question? You can enumerate, you can elaborate, but what is the basic concept of temperature regulation? अगर ये full marks का question आएगा, how you will start approach to this point? You will approach to the hypothalamus. First of all, write, in your hypothalamus there are two nucleus. In the hypothalamus there are two nucleus. One is called as anterior hypothalamic nucleus. One is called as anterior hypothalamic nucleus. Other is called as posterior hypothalamic nucleus, which has set point of the temperature. Now this anterior hypothalamic nucleus, always remember A for AC, A for air condition. It behaves like air condition. So air condition temperature को कम करता है कि बढ़ाता है? What do you think? Air condition decreases the temperature or increases the temperature? It decreases the temperature. It does not allow temperature to rise. And posterior hypothalamic nucleus behaves like a heater. If this is AC, it behaves like a heater. It usually increases the temperature. Always remember, it behaves like a heater. Suppose you are in a cold environment. Which nucleus will function? Posterior will function. If you are in summer, this nucleus will function because it has to maintain. We are homeothermic, we have to maintain the temperature. So that is why if there is lesion of anterior hypothalamic nucleus, what will happen? Hypothermia or hyperthermia? अगर एंटीरियर हाइपोथैलेमिक न्यूक्लियस का लीजन हो जाता है तो हाइपोथर्मिया होगा कि हाइपरथर्मिया होगा? व्हाट यू कैन गेट? अगर आपके एसी खराब हो जाता है तो क्या होगा? टेम्परेचर बढ़ जाएगा टेम्परेचर रूम का कि कम हो जाएगा? इफ एसी इज नॉट वर्किंग इन योर रूम इन समर कंडीशन, दे विल बी, it can cause hyperthermia. It can cause hyperthermia, and if there is lesion of the posterior nucleus, it can cause hypothermia. It can cause hypothermia, hyperthermia. So this is about the normal control. But what causes fever? Whenever there is infection in your body, it causes fever. What is mechanism of that? What is mechanism of that? Anyone? What is mechanism of fever? Suppose there is infection in your body. Let me write it. Suppose there is infection in your body. Infection causes inflammation. It increases secretion of interleukins, prostaglandins. Interleukins, prostaglandins, and this is your blood-brain barrier. Prostaglandin cannot cross it, but this is your set point, anterior nucleus and posterior nucleus, set point of the temperature. But when there is some changes of interleukins, prostaglandin will increase synthesizing in the hypothalamus, and this will increase the temperature of hypothalamus. This will increase the temperature of hypothalamus. Now in the set point, temperature is suppose 98.6, but because of infection it has temperature of 102. So now your temperature watch will confuse, and it will give signal to the body for shivering. Shivering will increase muscle contraction as well as vasoconstriction. So there are so many mechanisms by which anterior hypothalamic nucleus will give signal to the body, and this will increase the temperature of the body. This will increase temperature of the body, and this can cause fever. So how fever comes to your body? Whenever there is infection, any type of infection, it can be bacterial, which causes inflammation, which increases lot of interleukins, lot of cytokines, prostaglandins, and they initiate inside the hypothalamus the prostaglandin synthesis, which causes increase in the temperature of hypothalamus. Now your set point get confused, so it starts shivering, so that in the set point also temperature can become similar to that 102, and this is called as fever. But what happen if you give paracetamol? What happen if you give any NaCid? If you give any NaCid, this will suppress the formation of prostaglandin. This will suppress the formation of prostaglandins. What will happen after that? If prostaglandin synthesis is suppressed, what will happen? Again, this is your hypothalamus. This is the set point. Again, temperature will drop from 102 to 98.6, but your set point is having 102. So now this will give signal to cause what? Sweating. Now your body starts sweating, or vasodilation, and this will drop temperature to 98.6. This is how NaCid decreases the temperature. So this is the main concept. First you should know there are two nucleus One is anterior nucleus which behave like AC. One is posterior nucleus which behave like a heater which try to increase the temperature. So this is the normal physiology and this is about the pathology. Is this clear? So you have to just elaborate these concepts in a heading form. And what is heat stroke? When this set point is not working properly, you cannot sweat. Your temperature of the body remains high. It cannot be decreased. It is called as heat stroke. Okay. So what is FeV1? What is FeV1? Write a short note on FeV1. If they are asking to write a short note on FeV1, but this is of 5 marks. So if FeV1 लिख करके आ जाओगे, you will get only 1 marks. If they are asking about something, they want to understand the clinical relevance of that point. Is there any clinical relevance of that point? Okay. It is the amount of air expired in 1 second. Amount of air expired forcefully in 1 second after taking full inspiration. Okay, so what is the importance of that? For that you have to tell first of all what is FVC. FVC is the maximum amount of air expired forcefully after taking full inspiration. So why I'm telling about this? So that we can discuss about the clinical point. What is FeV1 by FVC? What is FeV1 by FVC? See, normally it should be more than 10. Sorry, normally it should be more than 70%. Okay, so now there can be two conditions. If it is less than 70%, what can happen? And if it is more than 70%, what can happen? If it is less than 70%, it can cause obstructive lung disease. If it is more than 70%, either it can be normal or it can cause restrictive lung disease. Example of obstructive are A, B, C, D, E. It can be asthma, bronchitis, COPD, emphysema. Okay, and restrictive lung disease can be of two types. It can be parenchymal. Either it can be parenchymal or it can be extraparenchymal. What are a few of the parenchymal disease? Any types of fibrosis like silicosis, asbestosis, berylosis. And extraparenchymal disease can be not of the lung but of the bony cage like pectus excavatum, then pectus carinatum, then scoliosis, then kyphosis. So you can diagnose by measurement of FeV1 by FVC. This is the clinical implication of FeV1. So after writing all this, you can get 4 out of 5 marks. So if they are asking about FeV1, don't think they are just asking about the definition of FeV1. You have to write what is FeV1, what is FVC, what is the ratio, what is the clinical implication. Okay. So I think this paper is over now. So this is it for today. After that, again we will try to take some special class also regarding this